on this final day of the 5-day course. And we have with us now Professor Santa Morris to start the lecture. So, sir, we can start the lecture to your convenience. The floor is yours.
Thank you so much. Good afternoon from Melbourne. I would say
Good afternoon. For us, it's a good morning. So good afternoon.
Okay. Good morning. Good morning, India. Can you see my slide, please?
Yes, sir, we can see it, sir.
Good. Okay, thank you. So, today we will discuss about the impact of overheating on low-income population and vulnerable population. First, we have really to understand that the problem of overheating is not just, a problem of some countries. It's a global problem all around the world. Actually, as we have already discussed, there are 13,000 overheated cities, 1.7 billion people which lives under very severe overheating. And since the 80s, the number of overheating hours has increased by, let's say, 3 times, by a factor of 3. And also, in China and in India, the exposure to heat waves increased by an average of 508 million person days per year during the last 10 years. What is very important to understand is really that during the very last years, the problem of overheating and the problem of climatic change, both in cities and in rural areas, has increased tremendously. As you can see from the graph I'm showing there, the mean annual number of hours with heat stress anomalies relative to 91 and 2010, this period, really is increasing tremendously all around the world. And this is very important and this is very annoying. The same happens really in all parts of the world. And I showed you the other day what is happening actually in India. A very, let's say, serious, indication and serious element that is coming to, on the table the very last years, and especially, last year, and this is published this year, in Nature, really associates the degree and the magnitude of the overheating with the length of heat waves, and shows clearly that for everywhere in the world, and a small increase even, of temperature corresponds to an almost exponential increase of, the duration of heat waves. So we may expect to have, heat waves by 2050 with a duration at least 20, 30, or even 50 days, as it is expected, in some parts of the world. And this is, of course, very, alarming. By 2050, almost 970 cities worldwide project to experience temperatures above 35 degrees. The number of cities with, experiencing temperatures above 35 degrees has increased by a factor of 3, during the last years. We had 354 cities, now we have 900, and we will have 970 cities. And of course, this means that this is not something really that we can neglect. We have really to take into account and design proper mitigation and adaptation, solution. And unfortunately, the size of the urban population, which will be exposed to extreme conditions, will increase by 800% and will be close to 1.6 billion people. Take into account really the increase of the temperature and the duration of the heat waves in some specific periods of the year. This number maybe go up to 3.5 billion per year. And of course, this is an exponential almost increase of the overheating population all around the world, and this has a tremendous impact on energy, environmental quality, health, and so on. We have, let's say, a lot of estimations during the very last years, which shows really the number of people that will be exposed really to higher temperatures. Uh, there are different estimations, and of course, all these estimations really are really bad. And, for example, the estimation about, according to, let's say, the World Bank, 4.5 billion people were exposed to extreme weather events. And this included, of course, not only heat waves, but floods, droughts, cyclones, and so on. The most important thing is that among these exposed during the last years, 2.3 billion people lives in less than $6.85 per day, and they place them in the poverty by global standards. So out of the 4.5 billions, 2.3 billions lives with just, let's say, $7 per day, and 390 millions live in extreme poverty below, let's say, $2 per day. So half of the world population, actually it is exposed to extreme, let's say, climatic events. But the most important is that about 70% of this population is, let's say, extreme poor. And this is not something that has to be neglected. And among all the extreme weather events, and especially the heat waves, affect the largest number of the people, almost 3.7 billion people, which are exposed to low or average or high intensity heat waves. And this is unfortunately the most widespread climatic hazard. And unfortunately, it is, let's say, predicted and forecasted that heat waves still dominate and will dominate as the most common shock. Many of the exposed to the heat waves live between, let's say, with an income of between $2 to $7 per day, which means that it's very simple. Heat waves affect the working poor in a very disproportionate way, which unfortunately these people, they don't have the means for cooling, healthcare, adaptive infrastructure, etc. And so you understand that this population is really susceptible to heat risk and health risk and productive losses and so on. So I think that it is very well documented that actually about, let's say, 2 to 4 billion people, almost, let's say, between 30 to 50% of the global population will expose to extreme, let's say, heat waves now and in the future. And unfortunately, this population, is very poor population. And the actual, let's say, forecast about the number of days above 35 degrees in Southeast Asia, including India, shows, for example, that the low-income population will be exposed at least 83 days per year, above, let's say, 35 degrees. But unfortunately, if, let's say, the temperature increase the next years will be 2 degrees, which is really moderate prediction, this will increase to 106. Anyway, what is very important is that the exposure to, let's say, extreme weather conditions is not the same for everyone. The high-income population in these countries really is exposed to high temperatures up to 16, let's say, days per year, or may exposed to 27 days per year, which is about, let's say, 1/5, or let's say maybe less than the exposure, the duration of the exposure of the low-income population. So low-income population and vulnerable population is really the population that is exposed, let's say, to heat waves. What is the real problem? The problem is that low-income population and vulnerable population lives in districts with really present a very high, let's say, temperature. And the urban heat island in these areas is really very high. In these areas, the temperature is much higher, and also they don't have any, let's say, proper greenery, and during heat waves, the districts experience extreme heat stress, intensified heat risk. So it is very well documented, and we will really discuss it later, that the low-income and vulnerable population lives really in districts or in urban neighborhoods which really present the higher overheating. Unfortunately, let's say the probability of heat-related mortality is really very high in, let's say, vulnerable population, especially in, let's say, aged population, in children's, and for all those that they have a pre-existing medical condition. And the socioeconomic vulnerability, lack of resources, let's say high temperatures, bad quality of houses, increases really the exposure and creates important socioeconomic and biophysical vulnerability, which has very, let's say, severe consequences to the low-income population. There are a lot of, let's say, research actually trying to identify what really happens to the low-income population and vulnerable population because of the overheating. I have tried to list, some of the, let's say, impacts that we know very well. And first of all, the main impact is that we have excessively high indoor temperatures and increased heat stress. Second, we have a very long exposure to high temperatures through the day or through the night. And also this means that we have very high risk of health really and decreased mortality in these areas. Another issue which is not so well known, but really it is something that happens actually, it has to do with the, let's say, mental health issues related to low-income population. And of course, there is a financial issue because it increases the energy cost for the cooling needs if they have really cooling possibilities. The other thing is that because of the, let's say, high temperatures, we have a substantial, let's say, loss of income because of the heat-related disruptions. And very, let's say, important working hours reductions and increased absenteeism. The other thing is that in these areas we have very severe strain on critical infrastructure and urban networks. And also there are problems of sleepiness and household tensions. These are among, let's say, the impacts of urban overheating, to low-income population, and I will try really to document them and discuss them, let's say now. Do we have really important, let's say, deprivations and important differences in our cities? Yes, of course. This is extremely well documented. For example, let's take one city from the developed countries, and especially the capital of the United States, Washington, D.C., which is one of the most unequal cities in the world. And you can see, for example, let's say the income of some parts of the, let's say, of the city. You see in this area where the average and rich population is living, the mean capita income is 88,000. In this area, the income is almost, let's say, 20,000. People who received food stamps in past 12 months in this area is just 1%. In this area is 41%, so they need assistance for food. The median house price is here about, let's say, 858,000. Here is 257. The 92% of the people here has really access to internet. Here is only 58. 54% of the population own, let's say, their own house. Here is 21%. Only 2% of the adults have no high school diploma. Here is 15%. 87% they have a bachelor degree. Here is 16%. Residents that are registered as disabled. Here is 6. Here is 18%. 92% of the population has a health insurance. Here is 38%. And of course, unemployment rate here is 3%, here is 12%. You understand that between these two areas, there is a tremendous difference. And I will come back and explain you why this happens. Let's take another city, Paris, which is also, a very developed city in France, of course, in Europe. And let's try to compare two, let's say, areas, two arrondissements, as they call it in French. The 7th arrondissement, which is the rich part, France, and Saint-Ken, which is an area where really the immigrants really lives. You see the income in the average income is 42,000, let's say, dollars. Here is 17. The income per household member is 130. Here is 34. It's a tremendous difference. Homes that they have a second, let's say, home is 20%, here is 1%. Rented homes is 1.4, they have their own house, here is 3.8. Active house business in the area, 19,000, 7,000. Employment compared with the population, 132%, 74%, and so on. So what I wanted to tell you is that during the very last years, especially in the developed countries, there is a tremendous, let's say, difference. What has happened? The decrease of the industrial, let's say, production and the industrial activities in the developed countries and the replacement of the industrial activities with, let's say, new, functions, new occupations, and new jobs, and especially, IT jobs or jobs which have to do more with services, has really pushed a very high number of, let's say, the working population, those that they used to live really and work for in cities and work really for industry, were pushed, out of the city. Why? Because they lost their income, because of the industrial, let's say, the decrease of the industrial activity. And so they have to look really for, to live in areas with much lower cost. So they went really to areas of much lower cost, deprived areas, which really present much lower cost. On the other hand, let's say the rise of the population with, let's say, working in the IT industry or, in industries of, let's say, providing high quality services, have really taken a tremendous part of the income in the country. And so they have really had the possibility to buy, let's say, the more expensive areas or to, let's say, live in the best parts of the city. At the same time, because of their availability, and the resource availability and the budget availability, they have increased the cost almost everywhere. So a tremendous, let's say, social and financial stratification has been created in these cities. And this stratification is not just only financial, it is climatic also. And this, let's say, stratification has an important impact on environmental quality, on infrastructure, on health and education, on everything. So this is what really happens actually in the developed countries. And this is very well demonstrated through, let's say, statistical data that you can see there. Actually, for example, in the United States, which really is a country with the highest differences, the opportunities remain completely unequal between the different ethnic groups. For example, according to, let's say, the US Census data from 2000, only 70% of the Black population above 25, let's say, 35 years old, completed 4 or more years of college, while, is much higher, let's say, for the white population. 24% of the Black population in the US had completed 4 or more years of college, compared to 34% of the white population. And despite the improvements in educational attainment over time, Black Americans remain more likely to be unemployed. So 7.5%, while for the white Americans is 3.8%. Also, there are tremendous economic disparities between Black and white population in the US. And these have increased through, let's say, the years. In 2000, white individuals earn on average 26% more than the Black individuals. And by 2010, that gap has widened by 33%. And you see, for example, that in the different graphs, the share of people really with education and higher and low education social, let's say, differences reflects really to important environmental, let's say, differences, which really first are, let's say, translated into the quality of the neighborhood where people is living. A recent study that has been performed in the United States and tries really to associate the income against the overheating in the neighborhood where people is living shows, for example, that low-income population, the blue, let's say, color, lives in areas in the United States or in the cities of the United States where really the overheating is up to 6 or 7 degrees higher than where really the orange part, the white population, is living. So this is extremely well documented, and the same happens in most, of the Western countries. And this means, for example, that, the low-income population living in the, let's say, overheating areas, they have much more needs, really, because they have really to fight against this overheating. Another, let's say, important also study shows, for example, and compares the average annual number of days where people is exposed to maximum daily temperatures above, let's say, 90 Fahrenheit, or 32 degrees. And you see, for example, that Hispanic and Black, they are exposed almost, let's say, 50, 60% more days than, let's say, the white population. And unfortunately, let's say the forecast for let's say for the future shows that that extreme heat could claim nearly 60,000 lives per year by 2050. This is extremely important. Heat stress really affects these areas of high temperature where the racial groups are living. And unfortunately, it is expected that the Black and the Hispanic workers will lose, about 500 million per year because of labor productivity losses. And under, let's say, the end of the 20th century climatic conditions, almost 5% of the American population, which is about 16.5 million people, could experience 100 days per year with let's say, with daily maximum temperature above, let's say, 32 degrees. And this is expecting really to increase tremendously in the future, increasing really the tremendous, let's say, differences between the different ethnic groups in the United States. Also, other studies show, for example, the income and thermal inequality in the United States. For example, if you take let's say, the inequalities in, for example, in several cities, for example, let's take Los Angeles, you will see that during an extreme, let's say, day, the thermal inequality between the high income and the low income population is close to 3 or 4 degrees, but in some other cities, maybe 4 degrees. So actually, there is a tremendous difference in climatic, let's say, quality of the areas where, let's say, low-income population and high-income population is living. Why I'm presenting also only, data from, let's say, from United States, because unfortunately we don't have enough data from, let's say, the other countries. I tried really to find what really happens in India, and there are some, let's say, events, there's some data about the number, correlating the number of heat events against the household monthly income. And this is a study that was performed by the Tamil Nadu Habitat Board in Chennai, India. And of course found that let's say, the low-income households are really more vulnerable to the heat-related risk because, let's say, of the lower income. This survey covered about 3,000 low-income households which were registered, and it's shown a very clear, let's say, stratification. And households with an income below 15,000 rupees reporting experiencing more frequent and intense heat events compared to better households. And you see, for example, the number of heat events for the low-income population in the graph, and the number of heat events for the high-income population. Of low-income, where a low-income population is living, they miss the infrastructure. They have an important problem of legal recognition. I'm sorry about it. And not adequate services. And, unfortunately, the density there is much, much higher. And also the residents of informal settlements, they face, let's say, a very high vulnerability to climatic, let's say, related disasters. Another important study that also is coming from United States, it shows that apart, of, let's say, the temperature in the different neighborhoods of the cities, and especially in Los Angeles, there is a tremendous difference regarding really the percentage of greenery in these areas. And you can see, for example, in the lower part that the higher, let's say, the income, the higher the evapotranspiration, which means much more greenery. Also, it shows that the higher the income, the lower, for example, the land surface temperature. So you have much, let's say, lower surface temperature, which means really the comfort is much better. This is very important, and this is extremely well documented, that I try really to present you some data really which shows what really is happening actually in the world. There's another study that we have performed recently, together with Chinese colleagues, trying really to understand the degree of the temperature increase of the surface urban heat island intensity increasing in the different parts of the world. And what really we found is that, unfortunately, the let's say surface urban heat island, or if you like, the temperature of the ground in the developing countries is increasing much faster than the temperature, of the ground in the developed countries. And this difference is really very statistically important, really, in all around the world. So this is very annoying because the tendency and the trend really for the future overheating really is intensified, especially for the low-income countries and for the low-income population. So at the same time, global, let's say, data coming from different parts of the world shows really the unequal distribution of the percentage of green areas across global large cities. And you can see, for example, for the high-income cities at the right, the green infrastructure is much higher, for example, than in the lower, it's 3 times higher than in the lower, let's say, income countries. So there is a tremendous difference, not only on income, not only on climatic conditions, but also on infrastructure, and in general, on everything that may, let's say, relates the climatic conditions with the environmental conditions. And apart, of the data that exists now, there is an important, let's say, knowledge that is coming, for example, from London, that shows that the access to public and private green space, when it is stratified by income group, is much higher for the high income population than for the low income population. It's not only that in the area they have less, greenery, but also the access is much lower. And also, the overcrowding, let's say, in these areas, and the density is much higher for the low income population. So I think that it is very well documented that actually low-income population is suffering really as it concerns the, let's say, not only the geographical and also the climatic conditions, but also regarding the infrastructure. There's a very interesting study that is published, a year ago from Brazil, trying really to, from Chile, I'm sorry, trying really to, let's say, associate the quality of greenery, not only the percentage of greenery, but the quality of greenery, let's say, against the different socioeconomic, let's say, groups. And, for the high-income groups, the quality of greenery is really close to 53%. It means that in the rich areas, the quality of greenery is really very good, and really contributes to important, let's say, benefits. But in, let's say, the low-income groups and the low-income precincts, the quality of greenery is much lower. It's close to 15%. So this means that the greenery that exists really in the low-income population, in the low-income districts, is not really able to, or capable really to provide important, let's say, climatic benefits. So I think that we have really documented quite well what really happens regarding the environmental, climatic, and financial conditions, in the low-income neighborhoods around the world. More and more we collected data, and more we understand. The situation is not the same everywhere, especially in developed countries, in, let's say, United States, in Europe. we have a tremendous difference between, let's say, the rich and let's say, poor neighborhoods. This is not the case everywhere, in the world. For example, in China, this difference is almost, let's say, negligible. There is no such a big difference because low-income population and high-income population, they live side by side or very close. So you don't see this difference. But unfortunately, in the highest part of the world, we have a tremendous difference between, let's say, the environmental quality of the areas. And what is important is to understand really the quality of housing, and especially the quality of housing of low-income population. Actually, the building sector is facing a significant shortage of really proper housing. About 1.8 billion people all around the world lives in informal settlements and under substandard conditions. In India, you know very well. About 2 billion people lives almost in, let's say, slums. According to the official standards, this is 1 billion, but depends how really the slums is really defined. And of course, there's a tremendous need really for safe and appropriate houses and for all this disadvantaged population. It is really shocking that in Africa, more than 56% of the urban population, most of which are really very young people, lives in slums. And you understand that with 56% of the urban population, and especially of the young population living in slums, the hopes really for the development of the area may not be so high. Also, something which is really very important is that by the end of the century, the urban and suburban land which will be allocated for future development will increase by 50 to 80% compared to, let's say, 2010, which means that the size of the cities will increase tremendously. But how? And what really kind of development we may have? We may have more slums, we may have more vulnerable and low-income population, desperate population coming to the cities living under the conditions that shown, in the let's say in the picture. Unfortunately, this is a forecast because the urban exposure to climate and disaster risk is increasing. Since the 80s, about 80,000 square kilometers of newly urbanized land has been developed in areas which have serious problems of flooding, in addition depths which exceeds 0.5 meters. So the actual developments in most of the developing countries, let's say, and in the most developing cities is happening, in areas with very high risk, mainly from, let's say, in low-income population with the proper, let's say, without the proper, let's say, resources and without any planning and without really any standards. And to understand really the expansions of cities, especially, these informal expansion of cities, this is almost 50 times higher than the area of, let's say, London. So actually we have a very serious problem in our cities. A very high part of the population really lives under non-proper conditions. And unfortunately, it is projected that this may increase. What's about the sizing characteristics really regarding the income? I have data really from the European Union, and especially, the area, the surface area of the houses as a fraction of income. For example, I showed you the data, for example, from Greece. And you see, for example, the low-income population is living in about, let's say, 60 square meters, let's say, per household, where high-income population, it has an average, about 120, 130, almost a double. And this increases continuously. So low-income population is living much lower and much smaller, let's say, houses. It's not the same everywhere. I suspect that in India it's much lower. But really there's a tremendous, let's say, the differences between the low-income and high-income regarding the surfaces. Also, the average number of rooms per person by household income, in the different parts of the world is really very important. For example, if you go to, let's say, to different countries. For example, if we take, let's say, Turkey, this is the high income, this is the low income, this is the high income. The average number of rooms really for the low income population is 0.3, for the high income population was 1.4. So there is, let's say, all around the European Union, but almost all around the world, really a very important quality difference between, let's say, the housing characteristics. The other thing is really the real energy, let's say, quality of the housing where low-income population is living. According to the data of the European Union, the percentage of population which lives in houses with leaking floors, walls, and roofs, let's say with roads and window frames, is much, much higher really for low-income population than for the, let's say, whole population. You see, for example, the difference that exists actually between, let's say, the high and low-income population. So low-income population, in conclusion, lives really in areas and neighborhoods with, let's say, much higher overheating, no infrastructure, etc., etc., etc. But also they're living in, let's say, in houses of, let's say, not appropriate quality.
So,
And at the same time, the same.
sir, can you please press the hide button there where it is Meet Google is sharing your screen? Can you please press the hide button? We are not able to read the graph completely. Could you please press the hide button? Hide. No, sir. Onto the left. No, sir, not that. Onto the left side. Stop sharing. Near the stop sharing, there is a hide. Meet Google is sharing your screen. That one. Yes. Please continue. Sorry about the disruption.
No problem, no problem. Okay, I see. Thank you. And also, you see, trying really to document the important differences regarding the quality of housing between, let's say, the low-income and high-income population. You see also data about, let's say, the leaking windows in Europe and the tremendous difference between, let's say, and the rotting windows between the low-income and high-income population. Also, trying to document also the environmental and energy conditions, in houses. You see, for example, that the percentage of in Europe, the percentage of people living, let's say, in insulated houses for the low-income population is 30%, while, let's say, high-income population is living about, let's say, 72%. Almost 22% of the low-income population lives in houses with double glazing. For the, let's say, high-income population, this is close, let's say, to 65%. Only, let's say, 9% of the low-income population lives in houses with, let's say, double glazing and insulation, while really for the high-income population, this is about 65%. So there's a tremendous difference regarding really the quality of housing. Another shocking, really, information that is published 2 days ago, from the UK, and I consider that it's very important really to report to you, is that actually in the UK, almost 5.5 million children, almost half of them in England, half of the kids in England, is in homes at the risk of overheating, according to the new analysis of the English Housing Survey. And you can see, for example, where these people is living. Most of them, they are in London. And according to this, survey, official survey by the government, actually homes in the UK are built to retain heat in a temperate climate with energy efficiency regulation for new dwellings now requiring room insulation. And it is more than sure that there is, let's say, an effort which is necessary to make homes more, let's say, greener, insulating homes and improve the quality in the housing. So half of the young population in the UK lives in overheating houses. And if you see the reports, there are, let's say, testimonies by people showing that they are not sleeping during the night, at home because temperature is extremely high, and they go to the car, and because the car is air conditioned, and they move around the city because they cannot really tolerate such a high temperature, let's say, in their house. So I think that we have really documented first that low-income population is living in areas of, let's say, very high temperature, and second, that unfortunately the quality of their, let's say, houses is really of bad, is not the proper one, and it's much, let's say, worse than the quality of housing, of the high-income population. And this, let's say, defines the, let's say, the overall vulnerability and the risk perception of the low-income population. Actually, there are many studies trying really to, let's say, understand the vulnerabilities and, the risk of, let's say, the different groups of the population in different countries. Unfortunately, most of these studies are performed, in developed countries. We don't have enough data from developing countries, unfortunately. But you can see that even for the developed countries, the, let's say, risk assessment and the vulnerability of, let's say, the population in, let's say, the Hispanic population or the Black population is by, let's say, by large, much higher than that of the white population. So it is really the tremendous difference between the different ethnic groups. And when really we move and we check really the vulnerability as a function of income, you will see that low-income population present an extremely higher vulnerability than, let's say, the rich population. And also, the disabled population, or people really that presents problem, vulnerable population, it has really much higher, let's say, vulnerability than those that really they are at, let's say, better conditions. So, in reality, you understand that even in developed countries, to be, let's say, an Hispanic or a Black, or to not to have the proper, let's say, income, is really something that gives you tremendous problems and increases tremendously really the vulnerability and the risk. And this is very well documented. On the other hand, let's say, surveys that exist about socio-demographic factors which are associated with heat wave perception in USA. Now we're discussing about heat waves and trying really to estimate the heat wave risk. Let's say for the different ethnic groups, here you have the white, and here you have the other non-Hispanic, the Hispanic, the Black population, the races. And the different dots and the different colors shows really the income. You see that this color, the blue colors, correspond really to the low-income population, and the red colors correspond to high-income population. You see that for each ethnic group, there's a tremendous difference between, let's say, high and low income. But also there's a very high difference between, let's say, the different ethnic groups. You see that the white, let's say, they have a much higher risk than, let's say, the Blacks and the Hispanic. So there is an important social difference between, let's say, the different ethnic groups in countries that they have ethnic groups, and also between the different, let's say, income groups. And also the trends really for, let's say, the exposure risk by 2050, by, let's say, having different forecasts all around the world. So, for example, that the vulnerability for the, let's say, low-income population and, population with higher, let's say, higher problems of social problems will be extremely higher than, let's say, for the rest of the population. Like 69% of the elderly heat wave exposure risk is coming from mid-income countries. And the regional average increase is 1.2 times higher than that of the high-income nations. So in these low-income countries, really, the expected vulnerability is really high, but is expecting really to increase tremendously during the near future. So in reality, it is clear that actually we have a tremendous really difference between the countries, and the tremendous difference inside the countries, but also this seems that it's going to be intensified in the future among the different countries and among also the population inside the country. And this is very clear as it concerns really the, let's say, the treatment of, let's say, patients in, let's say, in hospitals. And you can see, for example, for the the patients admitted via emergency department in, let's say, low-income countries and low-income, let's say, districts is increasing tremendously, really, for the low-income population as a function of temperature than for the high-income population. So the need for hospitalization really of the low-income population in developed countries, and these data are coming from Korea, is really much, much higher than the high-income population. Why? For the reasons that we have just mentioned. They are living, in areas of much higher temperature. They are not protected because the quality of their houses is really very bad. And also there is not the proper infrastructure in the area. So it is extremely well documented that actually the overheating is creating a much, much higher, problem to the low-income population than to the high-income population. Also, the same happens really, the study for, let's say, the compound impact of heat waves on vulnerable groups when we consider the age, the income, and the disability for the different, let's say, the different cities in Korea. For example, you see the risk, for example, for the high income is always, the blue one, is always much lower than the risk for the, let's say, low income population. And in a country which really is extremely well developed and really has a very good infrastructure. And I think that we have given enough data about really the actual conditions. And don't believe that there are so many data, and social studies around. But I think that it's very well, let's say, documented and very well understood what really happens between the various income groups in the different countries and between, let's say, the countries. And in India, you know it very well. But it's very important to, let's say, discuss about the real conditions, of, let's say, houses in of the low-income population. And we have a lot of data actually coming from, let's say, many countries, trying really to understand and document the living conditions, of the low-income population. Unfortunately, most of these studies are coming really from from high-income, let's say, countries and developed countries. But I'd like to show you what is happening, for example, in Australia, where a recent survey last year, heat survey, which was conducted regarding, the First Nation communities, the Aboriginal communities living in remote areas, responded to, let's say, to this heat survey. I'd like just to read you what really a lady from living, in the area said, because I think that this describes very well the conditions. Our home has no insulation. The windows don't have fly screens, and we cannot leave them open due to the insects and safety. The heat inside gives me frequent headaches and tiredness. I also have a child with disability who is affected by the heat. There is an air conditioning in the main living area, but it's old and has no been services in a long time and is completely unaffordable to run. My home feels like a prison sometimes in summer. This is what is happening really in the developed Australia. And also, some other reports shows that hotter days and homes with poor energy performance create hot boxes that cannot be cooled. People variously describe living in hot homes that they cannot cool as awful, unlivable, miserable, unbearable, torture, and a prison. About 80% of the people said that their home gets too hot in the summer. Almost 57% of the people reporting struggling to keep their homes cool. Several groups were disproportionately affected. Social housing tenants, let's say, had almost in a percentage close to 80% problems to keep cool their homes. And about 70% of those really that they receive income support. So you understand that for the low-income population, even in developed countries, indoor conditions are really terrible. But I will move and present you data also from Australia, from, let's say, a survey that we, let's say, performed 3 years ago here in Western Sydney, where really the low and middle-income population is living. So we monitor, the indoor conditions. I already reported it to you, but I think that is very important really to repeat it. And during the summer, but not during a heat wave, indoor temperature was, let's say, close to 40. But the worst is that because they close windows and doors and everything, really, let's say, indoor concentration of pollutants, especially CO2, was 4 times higher than the threshold. So in reality, these people really is living under overheating conditions, 40 degrees, with extremely indoor pollution. Also, let's say the survey we performed during the winter time shows that the indoor temperature during the winter time, in these houses was close to 5 to 7 degrees, no possibility for heating in these areas. So we have, and these are not really extreme poor people, these are really low income people, but they're not extreme low or extreme poor people. Another, study that I like to show you, and we performed really in Athens, Greece, some years ago during a heat wave in about, let's say, 300. This is in 50 low-income villages in Athens. So that during a heat wave, really, indoor temperature, was more than, let's say, 35 degrees for, let's say, more than 5 or 6 days continuously. And people really were exposed to extremely high temperature for more than a week, and really without any possibility for better, let's say, indoor climate. And on the other hand, some bulk data coming also from the United States, which really shows the share of the, let's say, the household, which experience unhealthy temperature and the distribution by race or ethnicity shows really that, for example, the share of households that kept their homes at a healthy condition, so they are not able really to cool it, as a function of the race or ethnicity, is extremely higher for Black and Hispanic population, 17%, while for the white population, 7%. As it concerns really the income, let's say, distribution, those that they have a low income lower than $25,000, 21 to 22% of them, they cannot really cool their houses. And for those really that they have a higher income above 75%, only 4% really they face a problem of, let's say, availability of air conditioning at home. So you understand that indoor conditions really differ tremendously between, let's say, low income and high income people. Is this, let's say, well documented all around the world? Yes. There are a lot of studies, mainly in Europe, and a little bit in the United States, which really shows that there is a tremendous, let's say, problem of, let's say, indoor climatic conditions, especially during the hot period, all around, let's say, the European continent. But the same, of course, happens all around the world, but unfortunately, we don't have enough data. Another important study that I like to show you from New Zealand, also a developed country, but with important, let's say, deprivation percentages, shown really across the summer of 21-22, it's very, let's say, very recent, and this performed across 5, let's say, hottest regions of New Zealand, shown very significant, let's say, disparities in exposure to indoor overheating. For example, it is found that the indigenous Maori household were disproportionately affected, facing elevated risk of indoor heat stress among with associated health and energy inequalities. You see, for example, the Maori, this is the green one, compared to the rest of the population, really present much, much higher, let's say, exposure to heat. So everywhere in the world that we have data shows a tremendous, really, difference between, let's say, the low income or the ethnic group against the others. These are some of the data that we have. And of course, the main question is how really low income and vulnerable, let's say, population can avoid indoor overheating. How this can be done? And to understand really how they can avoid overheating, we need really to understand the difference really in the specific needs they have. And I will start really with a study that we performed some years ago in Athens. And we try really to, let's say, calculate the cooling demand, how much really they have to pay for, let's say, cooling those living, in the most overheating parts of the city and those living really in the coolest part of the city. It is really tremendous. It is really a tremendous difference between, let's say, the two areas. For exactly the same house, the energy consumption for cooling in the lower part, in the low temperature, let's say, households and the low temperature areas of the city is close to 6.5 kilowatt hours per month and square meter, while really in the, let's say, the high temperature areas, the overheated areas of the city is almost, let's say, 120% more. So the people living, in the overheating areas, in order to cool their houses, they need almost to spend 120% more cooling, more energy. So the cost for these people is much, much higher. And this brings us really to the real difference between the cost paid really by the low income and the high income population. And this data from Europe shows really the cost of, let's say, with air conditioning and the cost without air conditioning as a function of the income. In the left part, you have the low income, and in the right part, you have the high income. You see that the difference in the low income is very high. If you have an air conditioning and you are, a poor guy or you are living in a poor household, you have to spend about 150% more energy than, someone which really has, let's say, you have to increase by 150% more the energy consumption that you spend really for cooling. And some data from India that really are published quite, let's say, recently, and by the International, let's say, Energy Agency, about, let's say, 3.5 billion people, not only in India, but all around the world, lives in hot climates, and only 1%, about, let's say, only about 50% own an air conditioning, with much lower, ownership in sub-Saharan Africa and South. And it is estimated that 2 to 4 billion people in the global South, or 20, exposed to heat stress due to lack of effective indoor cooling. So they are living in this kind of houses, this quality of houses in these, let's say, neighborhoods, but they don't have really the opportunity to have an air conditioning. Air conditioning, of course, is not available to households with no electricity and remains completely unaffordable for many low-income houses with electricity. And the lack of access, really, of electricity and the lack, really, of the resources creates an important problem for almost half of the world population, really, because of the accelerated increase of the temperature in our cities. But this is very well documented from a very recent study, which is published in Nature, which shows really the penetration of air conditioning as a function of, let's say, the income in the different parts of, in the different group of income in 4 developing countries, including India. As you can see, for example, that I have already shown you, the high-income population in India, they have almost 100%, of air conditioning. But the low-income population, the penetration of low-income population is 25%. In other countries, for example, Mexico, the penetration is really 1 or 2%, and in the low-income population. And unfortunately, if really we study the forecast about the future penetration, you see that even by 2050, the expected penetration of air conditioning, in these countries, and especially in India, will be too low for the low-income population, and there will be billions of people really without air conditioning. So the need really for cooling, because they are exposed to very high temperatures, may not be satisfied by using, let's say, air conditioning. And this because, let's say, of the lack of electricity, but also the lack of the resources. Why? Because let's say, the additional cost of the electricity and the use of air conditioning is not the same in all countries. For example, you can see, for example, that in low-income countries, Africa, and also India, Pakistan, etc., the real cost of, marginal cost of air conditioning is much, much higher than really in developed countries. So it's not only that there is no electricity, it's not only that they are living in, let's say, very, let's say, overheated areas. It's not only that they are living, in houses which not appropriate. The cost of the electricity and the availability of electricity and the marginal cost is also very high. So you understand that the obstacles that exist really for cooling and providing really comfortable conditions in these countries are really very high. And it's not a simple, let's say, condition, and simply really obstacles that have to be overcome. And there is also inside the country tremendous differences regarding the cost really that has to be covered by the different income groups. You see, for example, in India, that the cost, the marginal cost for the high income population is almost the double that for the high income population. So people really, they have to overcome a lot of obstacles, but mainly really they have to pay much higher cost than, let's say, the high income population because really of the economic and financial and technological conditions in the country. And one really we're discussing about, let's say, the very low income population are people living in slums, or like in the favelas, really, of Brazil, where there is a very recent and interesting study really about the way that people really is cooling their houses. You will see that, for example, in let's say in the favelas, or in the, let's say, in the slums of Brazil, there is no use of air conditioning. This is the red part. There is no use of air conditioning. And people really, in order to, let's say, cool down their houses, they go to the beach, or they buy ice water, or they drink alcohol, or they drink juices, or they drink soft, let's say, drinks, or they drink water, and so on. So you understand that there are no resources for the very low income population, and people live in Islam. And I like really to recall that about 2 billion people is living in Islam, 1/4, of the global population. And of course, there is no really any hope for this population, because there is no any new infrastructure, there is no any policy to improve the conditions there. And once we're coming back really to Australia, let's say the data shows that people, unfortunately, and especially the low-income people and the First Nation people, almost 30% of them, they don't have access to air conditioning or a fan. About 6% had air conditioning, but are broken. Almost 26% of them, they have, let's say, the air conditioning at home, but they don't use it because they cannot really use it, and because of the cost. And about 16% only can afford to use them. So in low-income population, even if you give them, the air conditioning, if you install the air conditioning, only in countries like Australia, only 16% of them may use it, And the affordability is really very important. This is very much affected by, let's say, cost. Almost, 80% of the First Nation people, 83% of the First Nation people here in Australia responded that they don't have really the affordability, they don't have the proper affordability really to pay the energy bills. And they cannot really use energy. And this is extremely important because these people, although they may have access to electricity, they may have access to air conditioning, they can't really use it because of the very high cost. And unfortunately, there are also important, let's say, other political issues. For example, something that is not so well known, the First Nation people here in Australia, they have to prepay the electricity. pay the bills, at the end of the month. For the low-income population, for the Aboriginals, they have to prepay the electricity. Let's say if they don't have enough electricity, if they don't have enough, let's say, credits, the electricity company is really cutting the electricity supply between 11 to 5. So during the, let's say, the whole period of the day, they don't have electricity for everything, no refrigeration, not for everything. This is something that happens to just few households, some people? No. 74% of the households experience more than 10 disconnections per year. So you understand that this is a very, very serious, let's say, problem affects the low-income population. And the other day, let's say I have shown you really the data about the disconnections. Almost 92% of the low-income First Nation population in Australia, they had a disconnection, per year, one disconnection per year. So this is a very serious problem, really, that shows that the way really that these people may, let's say, face the problem of overheating is not really the use of air conditioning or electricity, because they don't have the resources, they don't have really the proper houses. So we need really completely different approaches. And if you remember, I told you the other day that, let's say, in some parts of the United States where the low-income population is living, they apply exactly the same, let's say, policy, prepaid electricity. Actually, according to the official data of the United States, 23 million people in the United States, they have a problem to afford their energy bills. In major cities like Detroit and Philadelphia, almost, let's say, low-income population spends 15% of their income on electricity, heating, and cooling. And even in Los Angeles, where costs are slightly lower, low-income families still devote 15%, 14% of their houses for utility expenses. Each year, about 3 million Americans, or at least 3 million Americans, lose access to electricity because they can't afford their utility bills. According to the Energy Justice Lab, Hispanic households are 4 times more likely and Black households 3 times more likely to experience disconnection compared to the general population. But according to the sociologists, the true scale of the crisis is much higher. So you understand that the availability of resources and the availability of, let's say, the proper technological developments for the low-income population is a serious problem. And I told you the other day what has happened really in the United States, the very last period, where really in New York, they have really cut the electricity in 2025 for about, let's say, 150,000 people, during this summer. And really living, let's say, 150,000, most of them Black and Hispanic population without electricity for during, let's say, the heat wave period is something that you can easily understand really the impact. I will stop a little bit now and we'll continue a little later. And if you have any questions, please ask me now. Any questions?
Does anyone have any questions? Well, we always knew that the low-income groups are suffering because of heat stress, especially in a hot tropical climate like India. But the extent to which they suffer in various aspects about their affordability, I think that has been an eye-opener. And I think a place like India, we need data. I think what right now we don't, because even in India, if we take tropics, if we look at our cities and towns and villages, it's a completely different picture. We cannot generalize. What I'm trying to say is we cannot generalize between cities in India or towns or villages, and then there is so much of human suffering because of heat stress, which is a known fact. For example, the province that I am currently working in, where my institution is, Vijayawada, this Andhra Pradesh has the highest mortality when it comes to heat stress. Just because of heat stress, it has the highest mortality in the country. Yet we do not have the kind of data that you have projected. So for me, that's a learning that we need to collect this kind of data. Anybody has any doubts or anything you want to discuss about? Yes, Ms. Sumati Mohan. Please unmute yourself and ask your question or type it in the chat box. Anything, either ways.
Hello, ma'am. Hello, sir. Uh, Actually, I have no questions, but I have one request to sir. If he could provide yesterday PPTs that he has given on green technology, because my study area lies within that context, so it will be very helpful for sir if he will provide that PPT.
Can you repeat the question? Sorry, I lost you.
Sir, I want your yesterday PPT on green technology, which you have given yesterday class. I
Oh
want
yeah,
the
but I
PPT.
think that this is you will receive all the PPTs. Yeah, no problem.
Okay, okay, sir. Thank you so much, sir.
I think many PhDs are going to come out of your single presentations. Anyways, all the recordings of all this will be with IIH Hyderabad, and I think they will deal with it. So I think we will have access to the recordings in case. So don't panic about the content and the PPT. This is knowledge sharing, so definitely that will happen. Any doubts? Anything else you want to ask? I have lots of doubts. I have lots of doubts about how they collected the data, what were the conditions, because they said indoor temperature variation between low income, high income household. What was the condition of the openings? Were they ventilated rooms, non-ventilated rooms? Like this, I have lots of doubts, but I think it is more about the methodology.
Yeah, but in because for some of the studies that I showed you, I have performed the studies and I was present. Believe me that indoor temperature really was extremely high.
It's the same here, sir, in Vijayawada also, or rather in hot places in India, wherever we have tried to do this study, we find that the indoor temperatures are extremely hot, unbearable, and they make the women and children sick because they are the ones who stay indoors during the daytime. But I was just wondering whether the building materials is considered in the study that you have shown, because every time we try to put the data on the public domain in a presentation, this is how we are encountered. That is fine, but what is the roof material, wall material, were there windows, were the windows kept open, what is the percentage of windows, how compact or how not so compact was the settlement. So these questions would actually help us frame methodologies if we want to do a study similar to these.
And I understand what you're saying. Unfortunately, I don't have really the, let's say that the happiness really to perform measurements in these parts of, let's say, the world. And most of the studies that we have performed were really in Australia or in Greece or in the European Union. So I don't have the experience. But in my opinion, even if you perform measurements in different type of houses, really, it is very important to demonstrate let's say, demonstrate really that really these people living there, they have a serious problem, vulnerability. The scientific, documentation is important. And of course, when we like really to publish, we need to have all this data. But it is important to demonstrate what really happens there. It is very important, even if really the conditions, are not really so much really how many doors you have in the house. I don't care really about the materials. I care about the vulnerability of the population. This is the most important. This is a typical or non-typical, house in the area, and the temperature indoors was really 40 degrees, 50 degrees, etc. So this is useful information. Not perhaps really excellent documentation for, let's say, the engineer for an engineering journal, but this is very useful, let's say, social information and documentation. So we miss this information from the developing countries. We miss this information. We don't have this data. And this is the real problem. And perhaps, okay, what is happening, indoors and the temperature, etc., is something that, we can imagine. But the worst thing is about, let's say, the documentation on health data. What is the impact really of the high temperatures there? What really happens there? How many people really is dying? I don't believe the statistics given by the countries. I don't believe it. If you see, for example, the statistics given by India, or Bangladesh about, let's say, heat-related mortality, it's much lower than in Sweden or in Switzerland. I don't believe that this is the case. So in reality, we need to have proper data, good statistics. Everything is undercounted, and this really is not the real truth. This is not really what is happening in the country, and this is not really the real picture of the country. So I think that it is very important to document, and especially for the scientific really world in the country, to document really what is happening. And this will help really to take the proper measures. Without proper documentation, it's very difficult really to take the proper adaptation or mitigation measures. Is there any other question?
Thank you, Professor Matt, for the insightful presentation. I have one question. Considering that air conditioning is not common in low-income housing, especially in developing countries, and strategies like reflecting roofs or cool roofs and other passive retrofits are more practical, is there any manual or guidelines that recommends the suitability of these strategies across different climate zones, particularly for the informal settlements?
This is something that I will develop in the rest of the lecture. Well, I will present some of the solutions.
Okay. Thank you. Thank you.
Any other question? If not, let's continue. So I think that we have already developed, and we have documented really how much let's say, low-income population suffers from, let's say, the increase of the energy prices. But the increase of the energy prices really affects very much the overall quality, really, of the society. And the increasing, let's say, the increased prices and the increased energy cost is not really the same for every income group. And the increase of the energy, let's say, prices, which really happens in the world, let's say, all around the world the very last years, it has a very regressive effect on food expenditure. And you may not believe it, but the global energy price shocks, which really push millions towards deeper poverty, because really they have to spend more energy, more let's say, income for energy, show that in 116 countries, about 166 million and 583 million people, which represent almost between 2.4 to 7.9 of the global population, are at risk of falling into energy poverty due to surging energy costs. We may, let's say, push 8% of the global population to energy poverty because of the increase of the energy cost. So it's not only that these people is living in this, let's say, in these areas. It's not only that they don't have good houses. It's not only that really they don't have, but the energy prices are increasing for reasons that we don't have the time really to analyze those. And this push more, this population into, let's say, energy poverty. There is something that is very interesting that I want really to share with you, that according to the World Bank, let's say, for every 1% increase in food prices, this drives nearly 10 million additional people into extreme poverty. And this is extremely important. So really the dynamics of the global economics afford really the, let's say, social conditions in these countries. And actually, it's not only the static conditions that we have, that we described before. It's not the forecast for the future climate. It's also the global climatic and the global economic conditions. We have an aggressive increase of, let's say, all the services. This pushes more and more people really to poverty. What is the impact of, let's say, overheating on productivity and working time of low-income population? According really to the data of the International Labor, let's say, institution, when temperature really is increasing above, let's say, 30, 25, 35 degrees here, a very high part, you see close to 60% of the population cannot walk. And especially in countries like India, that a very high percentage of the global population is working outdoors, the income is decreasing tremendously. As I mentioned already, in the United States, the Black and the Hispanic workers, they have almost 18% higher productivity losses compared to their white counterparts. And it is estimating that about 2.5 billion workers, 70% of the global workforce, are exposed to dangerous level of heat, which really threats their, let's say, health, safety, and productivity. According to, let's say, data, unfortunately from the United States, under baseline climatic conditions, it is estimated that in the United States, they lose almost $100 billion annually due to declines in productivity because of the heat. Do we have estimates about, India? Yes. There is a recent report by the World Bank that shows really for 3 cities in, let's say, in India, Chennai, Lokku, and Surat, the percentage of, let's say, the GDP loss because of, let's say, the overheating and the loss of working time. And you see that really this may go up to 5 or 6% of the GDP of the city. Even, with the lower values, 2.5%, the losses are really tremendous. 2.5% of the GDP of, let's say, the city, because of the overheating and the loss of working time, is tremendous. And this really pushes tremendous number of population and a huge number of population into poverty. Let's say, the actual, let's say, earnings lost in billions in India, in these cities, may be close to $5 billion. And this is extremely important. Even under moderate estimates, 1.5 billion per year is really extremely high. And this, as you can see, will be intensified in the future. And the actual, let's say, forecast we have about, let's say, the loss of working time in Southeast Asia are really tremendous. It shows really that under the warm period in 2050, about 80% of the population really will not be able to walk outdoors. So you understand that the income of this population will be decreased tremendously. And it is very important to understand the impact of the overheating on health, productivity, and working time. As I already mentioned the other day, those that they are living in the warmer part of the city, they have 6% higher risk of heat-related mortality than those living in the coolest part of the city. But these are statistics coming from the developed countries. But it is very important really to understand what happens in, let's say, the developing countries. We have enough data from the developing countries. We know really what is happening in the developing countries regarding, let's say, the different incomes. For example, in the Netherlands, we know, for example, that when we have a higher temperatures, 1 degree, for example, above 22 degrees, heat-related mortality increases by 3.7% among the low-income groups, while for the high-income groups is 2%. So almost double. And while this happens, in a country with a tremendous good health infrastructure, I'm very curious to see what is happening really in countries without really the proper infrastructure. And also, we have really studies from other developing countries. For example, the heat-related mortality of low-income population, let's say of the young low-income population, is close to 3.7%. For, let's say, the high-income population is 2%. So in most of the countries, in most of the developed countries, the heat-related mortality is almost the double than the high-income population. And the other day, I have really mentioned to you that in New York, where the population of the black and the white population is almost equal, heat-related mortality of the black population is almost 220% higher than the heat-related mortality of the low-income population. And of course, exposure to high temperatures has a tremendous impact really on health. And we know that really let's say, exposure to higher temperatures may cause heat-related mortality and morbidity, breathing problems, cardiovascular problems, and many, many other problems. Just to understand that during the period between 2005 and 2015, visit caused by heat-related problems in the United States increased by 67% for, let's say, the black population, 63% for the Hispanics, 53% for the Asian Americans, and only 27% for the white population. So you understand that exposure to high temperatures, especially for the low-income population, has a tremendous impact on health. And similar results are also, let's say, collected from other countries. For example, in New Zealand, it shows really that the low-income population and ethnic groups present much higher, let's say, exposure to heat-related mortality and much higher frequency of heat-related mortality and other health problems. And the other important thing regarding and concerning the health and the, let's say, income, it has to do with the health, let's say, infrastructure. For example, the medical staffing. If you check, for example, the results of the, let's say, of the graph shown there, you will see that the number of doctors per 10,000 persons for the low-income population is much, much lower than for the high-income population. So low-income population is exposed to heat for the reasons that we have really described. And they have a much higher morbidity. They are going to the hospital, but they don't find any doctors. They don't find the infrastructure. And for this reason, heat-related mortality and other problems is much higher We know that it's almost double in the developed countries. We don't know what is happening. The other issue that really is very important is the impact of high temperatures on health, and especially on, let's say, mental health. Now we know that once temperature is increasing, the hospital admissions because of mental health problems, schizophrenia, different mood disorders, and many other things, is increasing almost exponential. And this is a very serious problem, and is going to be the main problem in the future. I told you the other day that the actual budget for mental health problems in the world is between 2 to 3 billion, dollars per year, and is going to be 50 or 60 or even, let's say, higher. There are different estimates by 2050. This is going to be the major problem. Fortunately, recent studies in developed countries, in London, show the disproportionality between, let's say, the hospital admissions for mental health problems of the low income and high income population. And what you can see is that in London, the demand for psychological support is almost 260% higher among the low income individuals compared to those with high income individuals. I think that it is very important to understand what's happened in the developing countries, to document what's happened there and protect the local population. Another important issue, it has to do with the cognitive performance of people. We know very well that heat stress is really one of the most significant environmental and occupational health challenges in our time. And there is a lot really of knowledge which associate the exposure to heat during the last 4 years with the cognitive performance of students. Why this happened? It's something that really we don't have the time to explain, but it happens. And what really it is shown through the analysis of millions really of students all around the world, including really developing countries, participating in the PISA exams, because all countries, including India, is participating in the PISA exam, is that there's a tremendous difference inside a country between the low income and the high income, let's say, students. The high income students, they have a much higher performance. And one of the reasons that really they present high performance, it has to do with the exposure to heat. Almost 45% of the reasons explaining the difference in performance is allocated to temperature exposure, but there are also tremendous difference between, let's say, the students of the different countries. For example, actually, it is known that the Brazilian students exposed to higher temperatures may present, let's say, 8 or 9% lower performance, not because of their, let's say, physiological issues or their cognitive, let's say, conditions, but because of the exposure to higher temperature than their Korean, let's say, students. So you understand that this affects very much the future, of our students. Fortunately, there are studies performed in India, and studies show, for example, that because Indians, they are, let's say, they are well adapted to higher temperatures, they may perform well under higher temperatures, but under, the temperatures really that does not really affect the cognitive performance of Indian are really close to 29, 30 degrees. Above it, really, there is an important, let's say, decrease of the cognitive performance. And let's move to the last part of this lecture that has to do with the technological solutions really to address the problem of overheating. There are many ways to do that. Of course, we need really better houses. This is out of discussion. But, the actual cost for, let's say, the improvements in the built environment cost really is really accounted, or it is let's say, estimated close to 1.6 trillion American dollars per year from now on to 2050. Unfortunately, this, let's say, budget or this specific, let's say, the availability of this specific budget, let's say, is very low. We don't have this money. Countries and governments, they don't have this money, and they don't have this possibility. We will discuss about it later, but this specific budget is not available. So I think that discussing about, let's say, an important improvement of the housing quality, especially in the developing countries, is something that for sure we want to happen. For sure it is a priority, but I'm not sure how this can happen really given the climate, the financial conditions in this country. So do we have other measures that easily and with low cost we may, let's say, help these people? Yes. For example, by using, let's say, the super cool materials, super cool paints, which are extremely cheap, may cost, let's say, less than, let's say, 20 cents, 25 cents per square meter. We can really decrease and the temperature of, let's say, the roof or of the houses of low-income population. And I recall what we have already discussed, that this, let's say, material may exhibit subabbient temperatures up to 10 degrees. So it's a natural air conditioning. And these materials really present almost 3 to 4 degrees, even in color, lower surface temperature than the conventional whites. We have tested these materials in, let's say, low-income houses here in Australia for the First National people. And believe me, we are able to decrease indoor temperature during summer up to 12 degrees. So instead of having people living under, let's say, 40 degrees and threatening their life and their health and, the quality of life of everything, we can really save lives by using these simple technologies. I know that in India there is an extended program of cool roof in some, let's say, in some states of India, and this may really help. And this is one of the actual, let's say, immediate solutions for the countries. I think that I have presented, this is the third time I'm presenting the results, of the World Bank about the impact of cool roofs in India. And according to this, study, the implementation of cool roofs in India may, let's say, save 317,000 lives per year. This is a tremendous, really, let's say, benefit for the country. And this is translated into 22 billion, let's say, dollars in productivity gains. But I don't have the time to describe you more solutions. In my opinion, this is something that we can do immediately, and especially, to use proper materials for, let's say, these buildings. The other thing, which is very important, is really the non-technological measures. Because if you believe that with the existing technology, we may save, let's say, and improve the quality of life of low-income population, you are wrong. It is very important, of course, to implement technology. It is very important to use technology, but it is not really enough. To do that, we need to have the proper, let's say, financial and policy tools. And the very first thing that really it has to be happen is to recognize the economic impact of, let's say, the overheating. Unfortunately, this is not recognized. This is not really taken into account. Countries, even the developed countries, they do not really count how much urban overheating and how much higher temperatures affect really the economy of the countries. Actually, it is really estimated that the annual cost of the overheating, of the urban overheating in the developed countries is something close to $500 billion per year. But this may increase up to $2.5 trillion per year by 2050. I don't know the cost, for, let's say, the developing countries. I don't know the cost for India. I want it really. I wish to have the data. I love to have the data. But these data do not exist. But for sure, it is easy to understand that this affects very much really the economy of the country. So let's really understand and let's really assess the economic, let's say, cost of the overheating in every country. Once this is assessed, then we can really, I'm sorry, I have to move a little bit just to show you something. We have to move really to find ways that this cost has to be, let's say, distributed among the population or among, let's say, the different groups. And this can be done easily. Why? Because we can create a market. We know how to evaluate, how to assess who is really increasing the temperature in the city. And if really the state or the municipalities or the councils or I don't know who is increasing the temperature, they have to pay the cost. The cost should not be distributed among everyone. It is not fair. So those really that they increase the temperature and really rises the cost of the overheating, and this cost is then distributed to everyone. Unfortunately for them, and fortunately for the rest, they have to pay the additional cost. And this really budget can be used really to alleviate poverty and help really those that they are in need. So this is something that has to be developed. This is already proposed through, let's say, the European Parliament and a big, let's say, committee for the European Bauhaus, as we call it in Europe, that I participated. And this is already, let's say, worked by the Union of the European Banks trying to implement. I hope that maybe will be implemented really in Europe. I don't know if this is possible really in developing countries, but it is something that has to be done. The second very important issue that we have already discussed it, but I think that discussing about poverty, it is extremely important to refer to. It has to do with the availability of resources, especially in the developing countries. The actual depth of the developing countries and of the world is $92 trillion. And unfortunately, the highest part really is, let's say, in some countries, China, India, etc. China is not a problem. China has tremendous resources in their banks. But this is not the case of India. And unfortunately, in developing countries, the rise of the debt is tremendous. I told you the other day that India is spending more really to, let's say, satisfy the annual debt than what it is spent for, let's say, education, transport, and health. So this is a tremendous loss, really, and a hemorrhage, really, that happens in these countries. If really this continues, I am afraid that developing countries will not have at all the resources to face the problem. We discuss about solutions. We discuss really about ideas for the future. We know that really problems are really becoming more and more, let's say, serious. And there is an intensification both of the poverty and both of the climatic conditions. And we know very well that we have really to react. But to react, we need to have the resources. And with the actual financial conditions in the world, this is not possible for the developing countries. So I will repeat what I told you the very first day. For these countries, we need to renegotiate the debt. We have to renegotiate. And for sure, the international banks, they may lose some trillions. It's okay. They have enough. You know, if they don't lose these trillions, we don't renegotiate really the depth of the developing countries, I'm afraid by the 2040, 2050, we will have 5 to 6 billion people, 60 to 70% of the global population living under very, very serious poverty and other climatic conditions that we never, let's say, have, let's say, in the past. In reality, by following this economic policy actually in the world, we have decided and we implemented to leave almost 50% of the world population under, let's say, extreme poverty and other unbelievable conditions. This is the result of the actual, let's say, economic system. The other tool that perhaps can be used is really to have a more fair tax system around the world. We have already discussed that the 1% of the richest people actually get 63% of, let's say, the global income. This is increasing tremendously. In 2010, it was about 52%, now it's 63%. It is expected by 2040 it will be close to 80%. So more and more of the world income goes really to very few people. The rest, which stays really for all of us, really, is not enough to face the challenges of climatic change, of poverty, of overpopulation, and so on. So what about if really we increase the taxation rate for these people? 2%, 3%, 5%. I'm not talking about 50%. I'm talking about 2%, 3%. In case that we increase the taxation rate really by, let's say, 2% or 3%, according to the existing, let's say, calculations, this will lift 2 billion people out of poverty. So in reality, we have the resources. We know how to do it. The problem is that we don't have the political tools to get really this, let's say, money. And if you really plot the actual, let's say, increase of the wealth of the billionaires in trillions, in the world, you see that it increases tremendously. What about if we take really this part? And so we bring their income down to, let's say, the income they have in the 70s. It's not a big problem. For example, to understand, in Africa, about 50% of the income, of Africa is owned by 4 people, 4 persons. So can we really re-examine the taxation in order to get the resources? And unfortunately, the tendency is that the taxation rate for these people is decreasing continuously. So I like to conclude by saying really what I said the very first day. We have a very serious problem. We have a very serious problem of overheating and climatic change. We have a very serious problem of overpopulation and a very serious problem of really poverty. But we have technology. We know how really to solve the problem, but we don't have the resources. Or if you like, we have the resources, but we don't use the resources. Why we don't use the resources? Because we don't have the policy tools, because we don't have the financial tools. So the conclusion is very clear. There is a tremendous difference in the world. There is a tremendous poverty. There is a tremendous, really, difference between the population. And the actual, let's say, policies and the actual climatic trends and the actual, let's say, tendencies shows that the near future we will have half of the population of the world living really under extreme poverty and very bad, let's say, financial conditions. I'm afraid that this is a decision. I'm afraid that the fact that we don't really take measures, it is a decision to leave this population really under these conditions. So my conclusion is very clear. Poverty exists not because we cannot feed the poor, but because we cannot satisfy the rich. Thank you. Questions?
Any questions from not only today's lecture, but all that we have seen in the last 5 days? What an eye-opening session it has been. So, do you have anything to ask? See, you people should ask more because most of you are trying to do research and PhD and things like that. We have lots of doubts and queries because we want to do similar work as faculty also. We are interested in doing the research. So, if you have any doubts, please feel free to ask students. And please don't leave now because we will take an attendance at say 1 or 1:05 for the close. So stay for the attendance. Any doubts? No doubts? Nothing? Okay. So, yeah. So there is some, yeah. Dr. Lily, did you ask the question earlier and get the answer, or should I repeat it?
No, I had asked.
You got the answer.
Yeah.
Okay.
He was presenting it after my,
Oh.
during the break I had asked.
Right. So there is a thank you also now from somebody. Okay. So I think as far as India is concerned, we have a long way to go after looking at your presentation, because first we need to get that much data and present it to the policymakers. And then all that will start, all that you say. But then one really good lesson that we saw today was how cool roofs is actually helping and how it can help the indoors to be comfortable. I'm not sure what it would do to the outdoors, because anyways the heat is reflecting outside. If it is not entering in, it is actually warming up the outside, isn't it? Or it's not so?
You mean that cool roofs warming the outside?
Yes,
Why?
will it? I'm just asking. We have not done much work on it. So
No. Cool roofs may decrease the temperature in the outside up to 1.5 degrees.
Right.
No, not at all. No.
So anyways, the indoors is safe with cool roofs.
The indoor, decrease of the temperature depends on the quality of the house. The house, the indoor temperature may decrease up to 10 degrees. In a well-insulated, good quality house, the decrease of the temperature may be 1 degree.
Right. I always had this doubt. We have a cool roof near our house, and we can see that there is a difference in temperature in the indoor. But I always had that doubt. I saw someone unmute.
Ma'am, this is Mukamika, ma'am. I just have an overall question.
Yeah.
Ma'am, ma'am, this is a behavioral dimension question. So, to what extent do people's daily behaviors like mobility choices, energy use, water usage, amplify or mitigate urban heat island effect? And UHI. So how do we monitor it? Because there is a lot of changes probably within a short time. So how do we monitor it, and how it will have an impact, or how it is going to amplify UHI?
How we monitor, experimentally, or how we collect data, you mean? Trying to reply to your question, to collect data and bad data and global data, you need to have a good, statistical administration. I mean that happens in the country, an organization of the, let's say, state services, how to collect the data. Let's say, administration, the quality of, let's say, statistical documentation in different countries is not the same. For example, in the United States, you have an excellent documentation and statistical analysis. In Australia also, there's fantastic, really, documentation. In Greece, it's good, but it's not so good, But this has to do really with, let's say, the organization and the overall structure of the state. Now, about the scientific, let's say, collection of data, this is something which is very trivial. How to measure really the performance in a building, how really to apply a protocol, how to perform measurements, how to perform measurements in the outdoor environment. There are so many protocols, actually, international protocols, defined, by international institutions. There's so much, of knowledge The scientific progress is really tremendous. There is no scientific barrier, actually. We don't have, let's say, lack of knowledge how to do it. If you like to monitor a house, if you like to monitor the city, if you like really to collect data from the scientific point, applying, let's say, different protocols. This is not really a scientific problem. And those that really they are using, some arguments that we don't know how to do it, simply they haven't really studied properly. Because all this exists, and all this is available. You may tell me that we don't have the equipment. I understand this. If you don't have the equipment, yeah, there's a problem. But now, in our days, the equipment that we may use is very cheap. It's extremely cheap. You can easily, buy sensors with cost less than $1 per, let's say, per sensor. You may tell me that this is not really the very high quality. Yes, I agree. It's not the best quality. You have an offset, of 0.5, 0.6 degrees. So what? If you are measuring temperatures close to 50 degrees, I don't care if it is 49.5 or 50.5. I care, and I like to know that this is the magnitude. So even if you don't have the proper, let's say, resources, try really to find the proper, let's say, the proper documentation and the proper understand what's happened in let's say, in your environment and what is happening there. I understand that for the scientists to collect documentation about, the global and the bulk information in the country is very difficult. And this is a disaster, especially for the social scientists. They don't have data. They can do nothing. For example, I think that it is really tremendous of what is happening not only in India but all around the developing countries with health problems. We don't know really the impact of overheating in these countries, and this really has a tremendous problem for the countries because they are losing, let's say, resources. Because the World Health Organization and many other institutions, they could really pump money to them because of, let's say, the problem. But once you report that heat-related mortality in India is lower than what is in Switzerland.
Thank you, sir.
Thank you, sir. Sir, as we spoke about the mitigation of urban heat island using various materials like cool pavements, cool paints, etc., but won't these materials have any other side effects in the long run, say after 1 or 2 decades when used extensively? As we also saw in a study in Hyderabad, the materials applied at certain instances did not give out such results as expected. This is a doubt.
Yeah. First, there are no side effects at all. There are thousands of applications, hundreds of thousands of applications all around the world. Hundreds of thousands of applications, no side effect at all. Why to have side effects? There is nothing really which is there, and there are no, let's say, hazardous materials used there, and there is no something really that may create problems. It's a myth. This is a myth which is really pumped by the, let's say, industry of the conventional solutions. Now, about your, let's say, results in Hyderabad, I don't have the knowledge. I don't know what kind of materials you have used. I don't know how this is measured. I don't know how this is implemented. But I can tell you, and this is more than sure, that there are, let's say, hundreds of thousands of cool materials and cool pavements and cool, let's say, cool roofs in the world. And in general, cool roofs decrease the temperature in the urban environment by 1.5 degrees and decrease substantially, the indoor temperature. Don't believe really the industry of conventional materials that they try to pump bad results. It's not really surprising that the Americans, they have installed 1 million square meters of cool pavements. They're not stupid. It's not really a surprise that they have really millions of square meters of cool roofs. They know what they are doing. The same, all around the world. So actually, the conventional, let's say, industry is trying to find, even among scientists, people that they say that this is not good. This has side effects. This has not good performance. Stupidities. This mitigation technologies have excellent performance. These mitigation technologies have very low cost. These mitigation technologies may save lives. So move. So move and go to the next step and use all these technologies and produce these technologies in your country and really create added value for the country and really create the proper industry to produce this. You have to move, we have to move to the next step. We don't have really to start discussing this is good, this is not good. Why? Black asphalt you have and we have everywhere is good with 80, 90 degrees. Why you are not asking about, the impact of, let's say, the black asphalt? Why you are not asking about the impact of all the other terrible materials we are using 1 year ago? So this is a propaganda by mainly, the let's say the conventional industries that they are losing the ground. We've seen that in the European countries. We've seen that really in the United States. So my, let's say, advice, if I can give an advice, is move to the next, let's say, step.
Right. Thank you, sir. Thank you. It was great listening to you. Any more doubts you have? Can we please discuss if there's anything else? No. No, I'm not getting anything in the chat box also. Well, doctor, it was a great pleasure to have you here. It's been actually, we've been flooded with queries. People wanted to have you here physically. But then, okay, we settled for the next best, but the outcome was excellent. I think you have given us way too many ideas. You have given us way too many perspectives. Now I think the ball is in our court to do this, and I'm very happy that we have a number of students who are interested in pursuing research, and every single slide and talk of yours. In fact, I would say every minute of what you spoke really were golden words, which is going to inspire so many people. Not only people who want to do PhD, but so many faculty or any other people who are interested in research. And then we have got lots of ideas about what we can do in the context of India. So I thank you so much, sir, for having first consented, and every single person is in awe with your energy levels, the way you have spoken hours together. So thank you so much for that. And I think our director, sir, is also joining. He just wants to thank you. So I'm just awaiting that. Doctor, is it possible for you to stay for just 1 minute? Because our director, sir, is a little keen to join and thank you personally. Just once.
I have to thank you also, if you allow me, first for the invitation and the opportunity you offer me really to communicate with you and your excellent students. It was a very nice experience, and really I'm very happy if I have contributed even a little bit, to, let's say, provide some knowledge or some ideas. It was really a pleasure. And I will be always available to all of you in case you want something additional. I will be very happy really to provide that information. And I like to close by saying that I will miss you. I will miss your group.
We will definitely miss all of this, but only thing is we have the recording with us, so we will keep replaying it so that no, we will not really miss the knowledge that you have shared. But not only that, you have also taught us how to be a great teacher, the qualities of a great teacher. I mean, your caliber is somewhere and you're addressing us, and you're trying to inspire the next generation about what all we can do. So we have learned a lot from you, apart from heat stress also. Your humility humbles us like anything. That you accepted our invitation itself is proof to your humility. And I thank you very much. And we also have Dr. Ramesh Rikonda, our director, the director of School of Planning and Architecture, Vijayawada. Sir, are you online? So many thanks floating around you. Sir, are you online? I just saw you. Dr. Lily, near
Yeah,
him.
yeah,
Could you please? I have been trying to contact Vamsi also. Can you please tell him because doctor is waiting. Dr.
yeah.
Matt Santa Monica is just waiting.
Just hold on. I'll just.
Yes, he said he is joining right away. Today there's an event happening, so he's a little held up. Yes, so I also thank Faiz, Dr. Faiz and Dr. Lily Rose for having contributed, and Dr. Prashanti also. Yes, our director sir has joined, Professor Ramesh Srikundaj. He has joined. So we have with us Dr. Matt Santamoris on one side and Dr. Ramesh Srikondaji on one side. So the 5-day GIAN program has come to an end and we all have benefited immensely. We do not know where to start, where to end now with all the knowledge that has been shared to us. So I would like to now invite Dr. Ramesh Srikondaji, our director, who has been very encouraging of me from the start to conduct this event, to say a few words to sir as well as the participants. Sir? So please unmute yourself.
Yeah, am I audible now?
Yes, sir.
Yeah. Thank you very much, Vijayalakshmi Madam. Good afternoon, distinguished faculty, esteemed guests, dear participants, and my dear colleagues. It gives me immense pleasure to be a part of this GIAN program. Heat stress and advances in passive cooling, particularly this is a valedictory ceremony here at the School of Planning and Architecture, Vijayawada, held from 8th September to 12th September 2025. This program, at a crucial time across the world, particularly in India, we are witnessing the increased severity in heat waves, urban heat stress, with Andhra Pradesh recording some of the highest impacts in recent years. The need to build climate resilient, livable, and sustainable cities have never been more urgent. I am delighted to note that 60 participants, including students, researchers, and professionals, have registered for this program, reflecting both the relevance of this theme and enthusiasm to learn from global and national experts. Through this course, participants gained exposure to urban heat mitigation strategies, passive cooling innovations, and advanced technologies that can help us reimagine our cities for a sustainable future. I also congratulate Professor Ayar Vijayalakshmi, Dr. Prashanti Rao, Dr. Fayaz Ahmad, especially to the international expert Santa Maurice, Professor Santa Maurice from UNSW Sydney. It's my great privilege to note a renowned and reputed, international reputed experts delivered the lecture and participated in this GIAN program. We are very much thankful to you, sir, and to the madam, especially the way the program has been conducted made it more successful. I hope the knowledge levels have been increased by attending this particular program with the great persons who involved in this one, especially the Santa Maurice ji and as well as Vijayalakshmi Ayya, Dr. Vijayalakshmi Ayya. I'm expressing my heartfelt congratulations and thanks to both of you. Thanks a lot. Dhanyavad. Jai Hind. Jai Bharat.
Thank you. Thank you so much for everything.
Thank you, sir. Thank you very much.
Thank you so much. Thanks a lot, sir. Thanks a lot, both of you. And for the participants, you have no idea. It's been more than 9 months since sir had given his consent, and it's all the paperwork that took so much time. And sir has been very patient, and he kept his word. I was so scared all along that he would say, "No, I gave my consent at that time." It's more than 9 months, 10 months now. I'm busy. I was so scared he would say that. He was very forthcoming as far as the dates are concerned, as the timings are concerned, and content wise, I don't know. I mean, as I already said, we are very, very grateful to you. Thank you, sir. And I just hope and pray and wish that you continue to support us and guide us whenever we need your guidance. Thank you so much. Thank you all. Thank you, up Director Sir, Dr. Ramesh Rikondaji. Without your support, nothing would have moved. But for your support, I wouldn't even have been motivated to apply for GIAN. Thank you so much. Thanks a lot. Thank you, participants. Thank you, each and every one of you. Thanks, participants. Thank you. Bye. Thank you, Lily ma'am. Thank you, Faiz sir. Thank you, Prashanti ji. Thank you so much.
Thank you,
Thanks,
Vijay,
participants.
for having organized such a wonderful session. It was so happy, like great. We are so grateful to you that we could hear such renowned persons from online sitting here in India and hearing to such an expert. That's great.
I would only say it is providence. I'm sure myself or nobody else could have done it. To get Dr. Matt Santamoris online is not a small thing. So it's,
Yeah.
I have no credit in this. I just think things fell in place and it was sheer providence. It's just that I so badly wanted such, and still I want the best in the world to come and talk to us and interact with us. So thank you all. Thank you all.
Thank you.
Thank you for making this a success. Thank you. So we could leave now. So thank you. We will get back to you on your certificates and things like that based on the attendance and all that. That back paperwork we will do, and we will get back to you. Okay. Thank you so much. So many thank you. Thank you. Thank you. Shrisha says thank you. Thank you, Shrisha. Thank you, Pooja ji. Thank you, Prem Sagar ji. Thank you, Chandramati ma'am. Thank you, Gauri Shenoy ji. Thank you, Tarika. Thank you, Sumati ma'am. Gajendra Singh ji, thank you. Shadman Nahid ji, thank you. Thank you, Hemalata. Thank you, Mugambika. Thanks a lot. Thank you. Bye.